Hello everyone. Today in this video we will talk about the peripheral blood smear examination. Now let's see the indications for it. First is the differential leukocyte count. Second is the differential diagnosis of anemia. Third is detection of parasites. Fourth is diagnosis of a leukemia reaction. Fifth is detection of platelet abnormalities. Sixth is a differential diagnosis of leukemia. Seventh is diagnosis of conditions like infectious mononucleosis. For preparations for peripheral blood smear, there are two types, thick and thin. First, we will study about the thin smear. For that, we have to take a drop of blood from the EDTA vacuity using the capillary, place it 1 to 2 centimeter away from the edge of the slide. Take a spreader slide and place it at an angle of 30 to 45 degrees. Move it a little backward and spread it in one stroke. Put it in a methanol jar and remove it at the moment. Let it dry. Put 3 to 4 drops of a Leishman stain. Wait for 2 minutes so smear gets fixed. Put distilled water or buffered double than the Leishman stain, so 8 to 2 drops. Wait for 8 minutes. Wash the slide from above using thumb water flow. Let the slide dry. Put liquid paraffin oil and watch it in 100x. Now the stains used are the Romanowski stain, which contains the Leishman, Jimsa, Wright, Phil, Jenner, and Jaswant Singh Bhattacharya. It has two components, methylene blue and eosin. Methylene blue is the basic dye and eosin is the acidic dye. So basic dye will stain the acidic component like the nucleus and acidic dye will stain the basic component of cell like cytoplasm. Now let's study the parts of the smear. It contains the head, body and the tail. In the head region we will see the cluster of RBC. In the tail region we will see the loosely spaced RBC. So we have to check for the slide in junction of the body and the tail. This is the junction of the body and the tail. Here we have to look for the slide. Now what are the qualities of the good smear? First, it should be tongue shape. It should cover 3/4 of the slide. It should not have irregular tail, should be free from waves and holes, should have smooth and even appearance. Now let's talk about the thick smear. It is for the detection of parasites like malaria and filaria. Procedure is place a large drop of blood in the center of a clean glass slide. Spread it in a circular area of 1.5 centimeter with the help of a stick or end of another glass slide. Dry it and you should be able to just see the printed matter through the smear when kept on printed paper. Why is the thick smear done? What is the purpose of it? If you have to check for a large amount of blood, then it can be tested for the presence of parasites. It can also detect the parasites, but for speciation, thin smear is more sensitive. Now, how we have to report the PBS? First, we have to report the RBC series. In that, we have to report the size, shape, color, inclusion bodies, and presence of any nucleated RBC. Then we have to report the WBC series. In that, we have to report the total WBC count, differential WBC count, presence of premature W cells, and other abnormalities. In platelets, we have to report the platelet count, morphology of it, and the distribution, whether aggregated or scattered. Next is the parasites. The following parasites can be seen in the peripheral blood smear, which is the malarial parasite, microfilaria, Leishmania donovani, trypanosoma, and some bacteria. Then is the other abnormal cells, and in the conclusion, we have to give the final diagnosis, and last is the advice. Thank you.